It's been a time of incredible growth, with organizations quickly pivoting and finding innovative technology solutions to emerging healthcare challenges. Healthcare challenges. Companies navigating the disruption raised disruptions raised record-breaking funding rounds and experienced unprecedented level of M&A activity as pandemic accelerated the need for an adoption of digital health technology. Digital health technology. Going into 2021, uncertainty still looms. But one thing is certain, folks, technology will continue to transform the healthcare landscape. Looking specifically at the financial aspects of care, we will see more providers embrace technology that frees them from administrative burden associated with billing and payments. Here it is what I predict for the year ahead. Telehealth is no longer a fad, folks. No longer a fad. Telehealth exploded this year in pandemic as patients look for care alternatives with social distancing. Healthcare organizations that had never before, not even occasionally, offered virtual care began to see it as a lifeline. It is offered both a way to reserve in-person care for the patients that needed it most, as well as a way for others to seek care for the safety of, their own homes. For the healthcare providers, for many healthcare providers, still facing significant financial difficulties, in 2021 will be a sink or a swim year. Those who adopt and leverage modern technology, such as systems that enable telehealth, will be better poised to succeed in the months and years to come. To bolster their competitive edge, I expect to see more providers focusing on improving their telehealth offerings, including finding ways to better integrate them with payments and revenue cycle technology, folks. Revenue cycle technology to offer more convenient digital experience for patients, especially the mobile technology. Further, I see a further consumerization of healthcare payments, folks. That's the way it's going to be. As patients take on an increasing amount of financial responsibility for healthcare, they're becoming more discerning shoppers and expect more convenience from their healthcare experience. This includes a demand for greater predictability and transparency around prices and billing. Yes, around prices and billing. American system of paying for healthcare has long remained complex and opaque. Amidst this complexity, providers and patients bear the burden and risks. Providers want and deserve clarity around payment. For health services, they have performed. Patients, on the other hand, often receive care without knowing the price for those services in advance and experience confusion with unexpected, surprisingly high medical bills. A recent survey found that consumers are more often concerned about medical billing than the quality of care they receive. That is true, yes. Quality of care they receive. Encouragingly, survey also found consumers have a strong interest in better understanding their financial responsibility. 67% of the patients are willing to explore the cost of care before going to the doctor. Yes. However, there's more need to be done, folks. 54% found that pricing estimates were not completely accurate compared to their final bill. With the final rule on price transparency going into effect in January 1st, we expect to see a demand for technology that provides patients with improved visibility into healthcare bills. Patients will expect to see more accurate and personalized estimates of what they all owe and easier, more convenient ways to pay. More convenient ways to pay. Moving towards real-time payments. Real-time payments. Technology that streamline and modernize payment infrastructures have made a major impact with banking and financial services to shore up back-end operations, digitize analog processes, provide better customer experience, folks, better customer experience. The healthcare industry is primed for this exact transformation, and I expect we will see an immense shift in how providers get paid. Today, it takes more 30 days on average for a provider to receive payments from their services due to complexities inherent in today's reimbursement models. This makes it difficult for providers to predict the cash flow. The slow and inefficient process of submitting a claim, waiting for a claim to be adjusted by the payer, and potentially facing denials that need intervention. Yes, that need intervention. Waste significant time and resources, folks. It wastes significant time and resources. Along with this lag, uncertainty around exactly how much will be collected from both the payer and the patient only adds to the financial and administrative woes providers face. Healthcare can learn from the payment models of other industries and improve the process by tapping into assets at their disposal. With massive data sets, technology, and smart algorithms, we will eventually shift to a healthcare payments occurring in real time, yes, at the point of care, creating a more seamless, less confusing experience for patients and faster and more efficient billing process for providers and the providers. To wrap it up, Technology innovation can solve biggest challenges within the healthcare payment, folks. They can. Streamlining and modernizing how providers, insurers, and payments interact with each aspect of paying and receiving payments of care. Payments when they receive the care. Healthcare providers owe it to themselves and their patients to take advantage of technologies and data sets that can make the process easier to everyone, folks, easier to everyone. As COVID-19 patient pandemic continues to unfold, I remain optimistic about our future, especially as our healthcare becomes increasingly tech driven and consumer centered. We will see organizations that embrace modern technology, adapt more easily to shifting environments, succeed financially, and remain focused on improving patient care. This is this is benefit for the patients, providers, insurers, all alike. This is the way the future healthcare payment is going to be in 2021, as per my predictions, folks. If you do like this healthcare personalized segment, subscribe, share, and hit that bell. I love you guys. This is Consumers Doctor on the behalf of Foremost Organization, continues to update on healthcare's topics right in the front line. Thank you. We will see you in the next episode. Goodbye.